Hello everyone, myself Ekta Arya as an assistant professor in Faculty of Pharmaceutical Science in Rama University. Today is my video lectures on the endometrial cancers. Then endometrial cancers is refers to the cancerous cells that is originated in the uterus endometrial wall. Then endometrial cancers occurs mostly in postmenopausal women, but also seen in the premenopausal women. A patient without metastatic stage can survive 5 years and more, and the survival rate is the 80 to 90%. Endometrial cancers, also known as the endometrial cancers, and also known as the uterine cancer. The alternative names of the endometrial cancer, such type of endometrial adenocarcinoma, uterine endocarcinoma, and uterine cancer, adenocarcinoma endometrium, adenocarcinoma uterus, and cancer uterine, cancer endometrial, and uterine corpus cancer. Then further complications. Endometrial cancers have the various complications, and such as like anemia and uterine perforations, hysterectomy, radiations, and chemotherapy. Anemia, that is the involving the loss of the blood in the endometrial cancers. Then second, uterine perforation. Uterine perforations occurs when DNC and biopsy are done. Then next, hysterectomy, radiations, and chemotherapy. It is the procedure for the treatment in the endometrial cancers. Then we will discuss about the causes and their etiology of the endometrial cancers. The exactly and the main causes of the endometrial cancer is unclear, but the higher concentration of the estrogens can increase the excessive growth of the endometrial cancer. And other causes are the such type of diabetes complications, estrogens replacement therapy, endometrial polyps, fertility problems, obesity, and starting menstrual cycle at a young age, and starting menstrual cycle after menopause above the age of 50. Then next, their symptoms. What are the symptoms of the endometrial cancer? The symptoms are the first is the abnormal bleeding per vaginal, and abdominal pain and cramps in pelvis. After menopause, white thin pelvic discharge is the most common, and then bleeding last more than 7 days. Irregular menses, and next, after years and more of no bleeding, but after menopause, spotting and bleeding is occurs. Then next symptoms, that is the painful urinations and pain during the sexual intercourse. And next, pelvic pain is the main common symptoms of the endometrial cancer. Then next we discuss about diagnostic tools. Diagnostic tools, there are various techniques, and diagnostic tools are used for the diagnosis of the endometrial cancers. In the early stage of the illness, pelvic examinations are common. In pelvic examination included the fallopian cervix, vagina, and fallopian tubes, ovaries are examined. When disease is progressed, then the changes in the uterus, such as the shape, structures, are also changed. Then the diagnostic tools are categorized into 3 types. First is the theoretical output, biopsy endometrial aspiration, and DNC. Theoretical output is also categorized in 7 parts, such as staging, X-rays, MRI, PET scan, physical examination, TVS, and CT scan. Staging is the process when the disease is progressed. Then the cancerous cells is also spread throughout the body, and the inside the uterus. So in the staging procedure, we examine the pelvic region. In pelvic region, doctors insert the speculum through the vaginal canal and collect the pap smear, and this pap smear sent to the lab, and pathologists study the cancerous cells for the further treatment. Then further X-rays. X-rays which examine the organs and bone within the chest, and MRI, that is the magnetic resonance imaging. It detect the descriptive image of the organs. Then the PET scan. PET scan is the positron emission tomography scan. In this this test is so important for the malignant cells which is throughout in the body. For the PET scan, mostly doctors used infusion of the sugar, sugar or glucose in the vein, and glucose is circulate in whole the body. As the comparison to cancerous cells, malignant cells are more active and consumed and take up of more glucose than the normal cells. So the PET scanner also reading on the body, and this PET scan show the malignant cells as a bright color. So this detect the malignant cells inside the body or throughout the body. Then further physical examination. Physical examination is the most common. That is the general health checkup, and such type of some cysts are not formed and lumps. This is the general health checkup. And then further है TVS. TVS, that is the transvaginal sonography. In TVS, doctors examine the pelvic region. It included a probe is inserted through the vaginal region and examine the pelvis region such as fallopian tubes, endometrial wall, and ovaries. Then further है CT scan. CT scan is detect the descriptive form of the images of the organs. Then next है biopsy and endometrial aspiration. Biopsy is the means collect of the cancerous cells, and this cells is collected and sent for the labs and pathologists study the these cancerous cells for the further treatment. Then next DNC. DNC is the dilation and curettation. In DNC process, we used the speculum and scraper by the vaginal canal. Doctors remove the cancerous cells and scrap the tissue from the uterus. Next, start the stages of endometrium cancer and their treatment. First stage and infected part and treatment. In the first stage, only the myometrium part of the uterus is infected, but not affected the whole uterus. This and their treatment is the progestin therapy. The next second stage. In second stage, only cervix part is infected, but not whole the uterus are infected. Then the treatment is the surgery. Mildly in surgery. Then third है infected part outer side of the uterus, means mostly outer side of the uterus means fallopian tubes and ovaries are infected. In this case, total hysterectomy are done. Then fourth stage. In fourth stage, pelvis regions are infected, and the treatment is the chemotherapy and radiation. Then next we discuss about the medication used for the endometrial cancers. There are many therapy, hormonal therapy, and other most recently used medicines are used for the chemo, and other techniques are also used for the treating the endometrial cancer. First, hydroxyprogesterone, and second hydroxyprogesterone, then second है megestrol, that is the form of the testosterone, and third medroxyprogesterone, it is the form of the progesterone, and other drugs, that is the doxorubicin, cisplatin, paclitaxel, carboplatin, topotecan, taxol, cremophor. These are the drugs which are also used in the chemotherapy and also used in the clinical trials with combination and without combination. Okay, thank you.